All right, we'll continue on with the placenta. So we have a few portrayals of 7.5 days, 12 days, 16 days. This is the 15 day we have in the lab. They're all about the same. And we see by the time you get to 16 days, you're down gastrulation. You have a trilaminar embryonic disc. Right there, 3 layers versus a 2 into 2. And I'm going to start to talk about the placenta, which is the chorion and the decidual villus there. And so I have to define some tissues. It's formed by these two structures, the chorion or chorionic villi and the decidual villus. And this is where the exchange of blood and mom's blood and baby's blood can begin to exchange metabolites like glucose and oxygen that can cross the placenta and even antibodies to confer immunity to the baby. And so, at around this time, you're going to get HCG. The trophoblast cells from the chorion secrete HCG, right? You're going to keep the corpus luteum alive for 3 to 4 months until the placenta can take over, which is about to. So here's the target of HCG, the corpus luteum, and here's HCG, right where we are, okay? This is gestation in weeks. You'll start to see this level rise after a couple of weeks. That's where we are. It starts to go up. And they'll go down, because when the placenta takes over, the sex hormones from the placenta can sustain things. All right, and so here's where we have, backtrack just a little bit, 13 days. It's bilaminar. Fast forward to 21 days. You see some changes here. You see the amnion encapsulating the entire embryo. We see the genesis of blood vessels in the yolk sac. And this is where we have a fully formed chorion. So don't get confused. Chorion is what we're talking about. If they happen to say chorionic villus, or villi, that simply describes the shape of the structure. Villi means like finger-like. Okay. So here's a close-up view of a chorion. Let's see if we can draw this out there. So we have blood vessels. Maybe these are embryonic blood vessels that are inside the chorion. You have layers of tissue around the chorion. The first layer is the cytotrophoblast. The cytotrophoblast is pointing to that pink layer of cells that completely surround embryonic blood vessels. So I'll draw a layer. These are a layer of cells. They completely surround the blood vessels. It's part of the chorion. It's the cytotrophoblast. So I'll list it as a layer here. Cytotrophoblast. You also have extra embryonic mesoderm between the blood vessels and the cytotrophoblast. So I left a little space there so I can kind of draw a little bit of tissue in between the two. So what I'm drawing in orange represents the proliferating extra-embryonic mesoderm, part of the chorion. Extra-embryonic mesoderm. And then surrounding that, surrounding the cytotrophoblast is syncytiotrophoblast. In green, that whole layer from there to there. Call it syncytiotrophoblast. Okay, those are the three sublayers of the chorion. And you can see that why this is the embryo, or excuse me, this is the embryo part of the placenta, because it's the trophoblast. That was always a part of this thing. And now it has blood vessels circulating blood through it, and it can make exchanges with maternal blood, which are in the lacuna between the chorionic villi. Okay. So imagine there's these spaces around it. I want to draw the whole thing again. Imagine that this continues on, and there's another space there. And there's the space in between is lacuna. And pretend it's all filled with maternal blood. The blood can enter this way. You fill the space between and have exchanges across the placenta there. So this blood that I drew in the lacuna is maternal. The blood vessels circulating here are embryonic. Maternal blood. On the figure, it's all this space here, filled with maternal blood. That's what you got.
A question.
Yeah.
You said the blood vessels were baby?
Yes, they're embryonic. That is correct. So basically what I drew on the board there are these blood vessels inside here. So we're at about 4.5 weeks now. You can see at 4.5 weeks, let's know what we can see. Weeks post-fertilization, you have a full-on amnion. It surrounds baby, also the embryo. Then you can see the yolk sac. You can see the chorionic villi. They completely surround the whole structure. But notice that the chorionic villi that are kind of underneath baby here are more pronounced. That is becoming the umbilical cord. Notice on the chorionic villi, the chorion on the side opposite is starting to get smushed. And eventually it'll get completely flattened. But these will form the chorion of the fully mature placenta. It's already operating. And distinguish between the chorionic villus versus the spaces in between, which are lacuna. Okay. And so here's a side-by-side of that picture. Here's a 1 month model representation that we have in the room. If you go from outer to inner, you have endometrium or decidua. Okay. If it's the side opposite, that endometrium is the decidua capsularis. What is it on this side? Basalis. Decidua basalis. If I point to a space in between, I'm going for lacuna. If I put it on the thing sticking out, that's the chorionic villus with the embryonic blood vessels. And you can see how the blood supply brings blood to and from baby. The white membrane is the amnion. The umbilical cord is right there. What I like about this figure versus this figure, the model shows that the blood is continuously renewed. They show gas exchange. You see how it changes from red to blue, symbolizing gas exchange? So this blood in the lacuna is not stagnant. It's supplied by about 120 spiral arteries, and the blood is continuously renewed. 120 spiral arteries supply blood to lacuna, which is continuously renewed. So if you fast forward to 4.5 weeks to 13 weeks, you can see that the chorion is non-villus. It's completely flat. Okay. This is what we looked at before to teach the three deciduas. Decidua basalis, Decidua capsularis, and Decidua parietalis. Lining the uterine cavity is pretty full. The cavity's full, okay? It's like a little sliver. So 13 weeks. You have a non-villus chorion. On the area that is on the back side of the baby there. Okay, well, anyways, call it chorion levae. Flattened one. It's not the placenta, but it's on the side opposite of it.
Sorry, what are you talking about?
If you look right, it's not labor on here, so you see the chorionic villus on this side, how they have the blood vessels in it? And see that color, that brownish color?
Okay.
That's the chorion. Now follow that brownish color all the way around the other side. See a little brown right there?
Oh, yeah.
There's no blood vessels there. It's all completely flattened. That's the chorion levae. Okay. Now, there's other things there. There's the chorion levae, there's the decidua capsularis, and there's the amnion. So note those two other things with the chorion levae. So chorion levae is 1. 2, decidua capsularis, which is basically endometrium. And thirdly, amnion, the membrane of it. Amniotic membrane. if you want to induce labor, you can rupture these three things. Well, we just commonly say your water breaks. And it spills out the birth canal. It's a true bag of water inside the amnion. Inside the amnion. If it ruptures by itself or artificially, well, you'd want to do it artificially if you're trying to accelerate labor. It could be formed by the obstetrician or a midwife. It's very painful because you're inducing contractions. But when you rupture it, those are the three structures you're rupturing: the chorion leve, the decidual, and the amnion. Okay. You can use an instrument. You could use a finger. Okay. Just trying to break that membrane. So here's a close-up picture of the placenta and the exchange of the blood vessels. So the physiology of the placenta involves students understanding the blood exchange there. Let me trace over something on this. There's a structure here that students, I always ask students what's missing. It's the decidual bacillus, and it's commonly missed by students on the test. So this is placenta physiology. And if you understand the decidual bacillus and the chorionic villi, then you're pretty okay. It's a two-part thing, the placenta. The decidual bacillus is pretty much the maternal part of it. That's what I said prior. And then there's the chorionic villi with the embryonic blood vessels inside. Embryo, fetus, whatever you're talking about, baby. Okay. Now, we trace right here. I'll just trace up to there. Color it in. This is the decidual bacillus. You guys have a tough time with that one. I'm not sure why. The decidual bacillus is the maternal portion of placenta. But notice it's going to be the stratum functionalis, the part of the endometrium right underneath it. They call it stratum bacillus. This is the functionalis, that's the bacillus right underneath it. Okay, but anyways, that's what we're going for there. And notice how in the lacuna, which is going to be this space here, I'll just kind of trace this space right there. This space here that I'm tracing is lacuna. And notice how it's filled with blood that changes from blue to red, symbolizing the gas exchange. The lacuna is filled with blood, is continuously removed. Now what I'm going to note are the blood vessels here. Notice inside this structure there, with this inside, that's the chorionic villus. finger like, here's another one down there, I'll trace that too.
It's the brown part?
Yeah. It's the brown part that's got the blood vessels inside it. That's the chorionic villus. So I'll star this.
Like it looks like a tree going through there?
Yeah, exactly right. Looks like there's a tree going through there. And what's the tree? The embryonic blood vessels. So what I would add is chorionic villi contains embryonic blood vessels. So it's important for students to understand what delivers blood, what drains blood, and the exchange occurs between chorionic villi and in the lacuna. So let's start with giving baby what baby needs. If you look at the maternal arteries there's a spiral artery, and it's dumping blood into the lacunar space. Let's note that. Let's use red, which symbolizes oxygenated blood, right there. I'm going to draw this, spiral artery, that one there. Let's call it maternal artery. Maternal arteries, I use red. These will deliver O2 rich, nutrient rich blood to the baby. Well, basically to the lacunar space. So O2 rich blood, O2 rich, I'll say nutrient rich. Food. To the baby. I mean, literally, it's to the lacuna. I put baby because that's easy to understand. Eventually, it gets to the baby. Okay. Well, anyways, that's the goods. Okay. So the mom does all the work. It delivers this much needed blood to the lacuna so baby can get it, and the maternal veins drain all the waste from the lacuna away from the baby. So they show a couple of maternal veins. And the direction of the blood flow is in the opposite way. It's taking it away. All the blue blood, the spent blood. So that's maternal veins. I use blue to symbolize spent blood. They're going to take O2 poor, nutrient poor, they're filled with waste products basically, away from lacuna, away from the baby. The blood volume of a pregnant mother, it may increase from like 5 liters to like 10 liters. It may double. Okay, there's a lot of blood circulation going on. Now, the maternal arteries and veins, fine, they're in the decidua. But what about the chorionic villus, their blood vessels? If you kind of study this, what you'll see is that in the umbilical cord, right there, you have one umbilical vein and 2 umbilical arteries. So how they illustrate it is, go over here. One umbilical vein and it's red. I'm trying to trace it there. It's right there, just one. But they have 2 umbilical arteries. I'll just draw the 2 little circles there. Okay, this implies 1 versus 2. So let's talk about that, because all of these embryonic blood vessels, they drain to and from the umbilical cord. So, one umbilical vein, and it's red.
Yeah, why is that?
It's reversed for fetal circulation. Know this about arteries and veins. Heart pumps blood away from the heart in arteries away. So, same thing for baby. Arteries away, but veins always return blood to the heart, vein in, remember? So this vein will return all that oxygen-rich, nutrient-rich blood back to the baby. So the vein has got the goods in fetal circulation, okay? Because veins are returning things. The direction of blood flow is this way, to baby. And it's picking up all the things in the lacuna. The mom delivered it. So one umbilical vein it's going to take oxygen-rich, nutrient-rich blood to the baby. That one vein is the lifeline of the baby. It accomplishes all the blood supply for fetal development. Okay. Now, baby is generating waste products, spent blood, and it uses the umbilical arteries to pump it away from itself to be exchanged at the placenta. So mom can take care of that spent blood. We have two umbilical arteries. Take O2 pour, nutrient pour, blood away from baby. So basically those four categories of blood vessels: maternal arteries and veins, 2. Umbilical arteries and veins, 2. I mean, the umbilical ones belong to the baby. They're using it. Okay, that's the system for it. So if you think about it in common sense order, mom's delivering the blood baby needs. Start with put number 1 next to it. Okay. What takes all the goodies from the lacuna and takes it back to the baby? This one umbilical vein. Okay, so that happens next. Secondly, number 1, in order. Okay. Let's think thirdly. Okay, you take this oxygen-rich blood, you exchange it within baby's body, and all the spent blood gets pumped away in the 2 umbilical arteries. Number 3, the umbilical arteries take it away from the baby. It gets to the lacuna, and then what? The maternal veins will then take that blood away, and her body, mom's body, will handle it. Number 4. So if you want to think of it that way, whichever way, just kind of understand which way blood is going. To baby or away from baby, the exchange is always occurring within the lacunar space. Any questions?
Yes.
Yeah.
So you know how the umbilical vein is 1 and there's 2 arteries?
That is correct.
So if one is missing, can the fetus survive?
If what is missing?
One of the umbilical arteries or either the vein?
Um,
Can that happen? Yes.
I know the vein, if the vein is compromised, the baby will die, probably stillborn. And there are cases where the umbilical cord gets wrapped around the baby, and that leads to the arteries. I think you really do need both of them. If you see changes in the pressure there, and one is not available, it's not good. Any kind of kinking of any of these is not going to be good. Was that your question? Can you live without one of them?
Yes.
No, you can't. And the umbilical cord, the blood flow has to be absolutely continuous. I'm sure you can monitor the stress of the baby if something's wrong with circulation. Yeah, another question.
My firstborn had 1 artery.
Oh, really?
Yeah.
One umbilical artery?
Yeah.
And it was okay? Was there any complications? Okay, I learned something new. You can have 1. I didn't know that. Now, only 1 developed? Or was that there's 2 and 1 pooped out?
They said it was a 2-vessel cord.
Oh, okay, maybe that's a common thing. I better do my research.
It made it high risk.
Oh,
Yeah.
see?
But he was fine.
Okay.
9 pounds.
That's the most important thing.
Would one take over and start doing more work since there's less now?
Oh, let's go back to you. What made it high risk? What was the
That it
risk?
was 2 vessels.
Yeah, I know, but what's the risk? Did they tell you? Yeah, that's kind of why I was like, all surprised. Oh, yeah. So you can do it. We have a case here, and but it is more risky. Yeah.
Mine?
I'm sorry. Yeah, Elizabeth.
I had the same.
Oh, that's why you asked.
issue, so
Two
that's
port,
why I asked.
2
And-
vessel port.
Yeah, and then it was a skipper. So I
Oh, I'm
was-
sorry to hear that. Yeah, so in some cases it can turn out, some it's not so good. It's all about blood pressure, and resistance to blood flow would occur if there's only one. Yeah. So when we get to blood pressure, that'll become more apparent. You learn how blood circulates throughout the body, because you want the pressures to be appropriate. But everything can happen. Why don't we move on from the placenta, unless there's more questions? Well, let's skip to labor and delivery, or partition. Baby departs the uterus there. It starts with contractions, these are the painful contractions of labor. They begin at the top of the uterus, they sweep in a wave towards the cervix. They're strong, they occur at regular intervals, and they increase in force and frequency. Ideally, you want the change of the fetus position to be head first toward the cervical canal. I can remember when I had my kids, they said, gave me this little 511 to help remember when to go. When contractions are 5 minutes apart, each contraction is about a minute in duration. This happens for about an hour. My first daughter was born, we went to the hospital, this was occurring, and my wife was about 4 centimeters dilated of the cervix, and they accepted her. It could be you're not dilated enough, and they'll send you back home. Well, anyway, here's a picture of baby inside the birth canal. This would be a natural birth. The cervix dilates. That's the first stage of labor and delivery. It begins to shift towards the cervical canal. It lasts about 8 hours. The water breaks. Okay, I defined that earlier. And a cervical exam, there's a few things that they're going to look at here that I want you to know. So a few things to look at in the cervical exam. Is dilatation or dilation. Cervical canal must dilate to 10 centimeters. That's the goal. Okay. And they kind of give you a visual representation. That'll accommodate baby's head. That's one thing to look for. The other thing is called effacement. The cervix kind of thins out, and they report it as a percentage. This can be palpated and reported by the obstetrician. A thinning of the cervix. So 0%, baby's head is pressing down, but it's not thinning out the cervix at all. But as it's getting squished there, that would be about 50% effacement. The goal is about 90% effacement. Okay, baby's head pushing down, thinning out the cervix. So make sure you can palpate that. So 90% effacement is the goal there. The other one is they use an anatomical landmark, the ischial spines, to locate baby's head relative to the spines. Now the ischial spines are right here. The narrowest part from side to side out there. There's baby's head bearing down there. Here's an overhead view of that model. So yeah, that's the landmark there. Position of baby's head is station. Position of baby's head relative to a landmark, spines. Well, we teach it as ischial spines. So basically, if the top of baby's head is at the same level as the spines, they call that 0. Well, let me show you a clip. I think it'll illustrate it better. Hold on a second. So there's no sound, but
Thank you.
okay, anyways. -3, you're 3 centimeters above. -2, 2 centimeters above. There are the spines. And so when you're at 0, top of head is at the level. Yeah, you're basically getting down now, +1, +2. And when you get to +3-ish, you're essentially delivered. Swine everywhere. Well, anyways, position of baby's head relative to the ischial spines. Yeah, this guy does a good presentation of it. Maybe I'll post his link later. So there it is. Goal is +1, +2 station. Goal. In the cervical exam, they'll just kind of shout out the numbers without units. So if they say 480, -2, -2, it's 4 centimeters dilated, 80% effaced, -2 station. Or if they shout out 10, 100, +3, it's 10 centimeters dilated, 100% effaced, and +3 station. Okay. An epidural could be administered to help mom during this time, where they insert a catheter in the epidural space. It'll pretty much numb everything from the waist down, so those labor contractions are not felt. Here's a picture of baby being born. The placenta stage is when the placenta detaches. Decidua is actually a word that means it falls off. Like deciduous leaves on a tree, the leaves fall. So that's why they kind of call it that. It's the appropriate naming. It comes off about a half hour after the baby is delivered. That's it. That concludes the material for your unit exam. If you look on the schedule, you have a quiz on Monday. The quiz will cover physiology. So for Monday's quiz, we're going to scan those little scantrons. Let me show you. Bring one of these. I'll study everything from Tuesday to today. Okay. And for the rest of the time, I'm just going to allow you to study models. So let's go right into lab time. Just be ready for your quiz on Monday. And think about the time you have left to study for your exams. Since I'm kind of done lecturing, on Monday, we have the rest of the day to study models. On Monday, you'll come in and take the quiz first thing. Group A, 8 o'clock. Group B to follow. The rest of the time on Monday, I'll just let you study the whole day. Okay. Do whatever you want. But then, what's Tuesday? lecture exam, and after the lecture exam, I'll give you more time to study for the practical, which is on Thursday. So you even have Wednesday in between to get it all down for open lab. So that's it. So the rest of the day, just go ahead and go right in the labs. Just start studying.
No, I need to finish.